Hi, I'm Dr. Annie Savage. I'm a naturopathic doctor. In today's video, I want you to learn what being on the pill, the birth control pill, does to your body and how you can successfully come off of it so that you can get pregnant more easily. Remember to like this video and subscribe to our channel. Click the bell to get notified every time we have a new video out, which is every single week. The oral birth control pill is commonly referred to as just the pill. Everyone knows what the pill is. This is one of the most common contraceptive devices that we use today, and it is 99.9% effective when it's taken properly. You do have to note that it is not protecting you against any sexually transmitted infections, so you do need to use another method to control that. Most commonly, the birth control pill is used to prevent pregnancy. Some other reasons that women are prescribed the birth control pill is for problematic periods. So when women have really heavy flow, lots of clots in their blood, really painful periods, headaches with their period, acne, weight gain, their doctor might tell them that they should take birth control and it will help regulate those hormones. It is true that we are normalizing or regulating your hormones when we take a synthetic hormone, which is what the pill is, but it is not addressing the cause of any of those symptoms, which is an unbalanced hormone profile. The way the pill works in preventing pregnancy is that it is stopping the egg from being released from the ovary so it cannot get fertilized. It's also changing the lining of your uterus so that it is thinner, making implantation a lot more difficult for an egg. And lastly, it is also changing the cervical mucus. What that does is it stops the sperm from being able to swim up the cervix to the egg. One of the effects of being on the pill is that your body actually makes much less of its own hormone. When your body is being fed outside hormones, it then doesn't have to make as many hormones for itself, so it will stop making it. That's one of the problems we see when we take you off the pill or you want to get off the pill, is that you may have a difficult time restarting your period, getting a normal period, or even starting to ovulate again. Since the pill has synthetic hormones in it, it is a bit more work for our body to break those down and actually make use of them. So being on the pill does add a bit more work for our livers, and we actually deplete some key vitamins when we're taking the birth control pill. So vitamins that we become deficient in are vitamin C, calcium, zinc, magnesium, vitamin B12, B6, and folic acid. Like I mentioned earlier, some women have a lot of trouble trying to get pregnant after they come off the pill if they've been on the pill for 5, 10, 15 years. Nowadays, we're seeing that women are put on the pill a lot earlier than they used to be. So people are being on the pill for a really long time. For some women to come off the pill, they have no problem getting pregnant at all. Then we have some women who actually never ovulate again. And then we have this spectrum of women in between where it may take some time, it may take 6 months to a year to re-normalize your hormones and your period so that you can get pregnant. What we want to do is help you while you're on the pill so that when you transition off the pill, you have a much easier time with your fertility. And if you're not trying to get pregnant, just having a much easier time regulating those hormones again so you can feel really good. How long have you been on the pill for? Leave a comment below and tell us your oral birth control story. Did you have an easy time coming off? Have you ever gone off? Let us know what you're going through. While you're on the pill, it's ideal if we can start to replace those nutrients that I mentioned that become deficient while you're on the pill. So we can start to do this by looking at your diet. You can start to increase your B6 by eating foods concentrated with B6. So buckwheat and rye, carrot seed, ginkgo seeds are all really high in B6. One of the other nutrients that I mentioned was folic acid. You can get a lot of folic acid from legumes. So those would be your lentils, your beans. Also, you can get your folic acid from green leafy vegetables. Kale, spinach, those are great options. We also want to increase that vitamin C profile, so you have all your fruits, your citrus fruits in particular. One of the things we do suggest with a lot of women is to take a female multivitamin or a prenatal vitamin while you're on the pill so that we can replace those vitamins that are being diminished with the metabolization of the pill. We also want to support your liver as much as we possibly can because it's doing so much work making hormones, metabolizing them, and then now it has to metabolize those synthetic hormones that we've added to the system. So you can support your liver by increasing your intake of brassica vegetables. Those are those stinky vegetables. So your broccoli, your kale, cauliflower, Brussels sprouts, bok choy, cabbage. All of those are fantastic liver supports. Another way that we can gently and effectively affect your hormones with food is by seeds. So we call this seed cycling, where you take certain seeds at certain times of the month to eat with your period or with your hormones. So in the beginning of the month, your follicular phase, this is when you have your period up to about day 14 around ovulation, you would take 1 tablespoon of fresh ground flax seeds and 1 tablespoon of pumpkin seeds. Add them to your meal in some form that day for the first 14 days of your cycle. The second half of your cycle, we want your progesterone to be higher, so we take 1 tablespoon of sesame seeds and 1 tablespoon of sunflower seeds, and these will help elevate that progesterone and keep you in your proper cycle. I'll add a link below to download a full guide on how you can implement seed cycling into your diet. The best thing you can do for yourself if you have to be on birth control is support your system while you're on it. If you don't have to be on birth control, then there are other choices for you. There are non-hormonal methods that will affect you much less than the oral birth control. So we can talk about those in a different video. If you would like, just leave a comment below and we will be sure to do that for you. It's ideal to support your system as much as you can while you're taking the birth control pill. If you can add in these tips and tricks that I just mentioned for 3 to 6 months before you come off the pill, you should have a much easier time when you do actually come off. You still may need some help once you're off the pill, and that's because you may have been on the pill for a very long time. You need some more diet and lifestyle changes, but that's what we're here to do. We're here to help you with all of that. Thanks so much for watching our video all the way till the end. If you have any questions or comments, please leave them below. Don't forget to like our video and subscribe to the channel. Click the bell for notifications for a new video every single week. Thank you.